Welcome to The Explainer. Today, we're launching an investigation into a condition that's incredibly common, but also really mysterious. It's something that operates completely in the shadows. So let's just start with a question that gets right to the heart of this. What if there was a thief, someone so subtle, so skilled, they could steal something precious from you day after day, and you wouldn't even have a clue? Not until it was way, way too late. And look, this isn't some figure of speech. We are talking about a real culprit here, one that operates right out in the open, silently stealing one of the most precious things we have.
All right, so it's time to name our suspect. Let's find out exactly what we're dealing with.
Okay, so the official name for this thief is glaucoma. And it's not actually just one thing, it's a whole group of eye conditions. But they all have the same goal, to damage your optic nerve. You can think of the optic nerve as like the super important cable that connects your eye to your brain. And glaucoma's weapon of choice? Pressure. Abnormally high pressure inside your eye.
So how does this all happen? To really get it, we've got to go directly to the scene of the crime, inside the human eye. Now, the best way to picture what's going on is to think of your eye not as this super complex organ, but as something way simpler, a kitchen sink. Seriously, this analogy makes everything click into place. This breaks it down so perfectly. So, in your eye, you've got a faucet that's pretty much always on, producing this fluid called aqueous humor. Now, normally, that fluid just flows out through a tiny little drain. But here's the problem. In glaucoma, that drain gets clogged, and the faucet, it doesn't turn off. So the sink just keeps filling up, and the pressure starts to build and build and build. And that pressure ends up crushing the delicate fibers of your optic nerve. It all starts with a simple clog, but the consequences, they're devastating. Okay, but wait a second. If all this pressure is building up and all this damage is happening, how on earth does this thief operate without setting off a single alarm? How does it pull off what is essentially the perfect crime? This right here is the absolute core of the mystery. The most common type of glaucoma is so successful because it has no early symptoms. I mean, zero. No pain, no redness, absolutely nothing to give you a heads up that something is going terribly wrong. And the reason it's so silent is, well, it's pretty astonishing. This thief isn't working alone. It has a powerful accomplice in the cover-up, and you're not gonna believe who it is. It's your own brain. This visual just illustrates the whole cover-up perfectly. So as glaucoma starts damaging your optic nerve, you begin to lose your peripheral vision, your side vision. Your eye is actually seeing an image with big missing patches, kind of like what you see on the left. But your brain is so smart it hates gaps, so it just fills them in. It creates a complete, seamless picture for you, just like the one on the right. It's a perfect illusion, all while the real damage is still happening. And here's the really scary part. You might not notice a single thing is wrong until the damage is already severe. I mean, we're talking up to 40% of your optic nerve can be destroyed permanently before you even begin to notice a change in your vision. 40%, that's a huge head start for the thief. All right, so every good investigation relies on clues. And even though this thief is silent, it does leave a trail. We just need to know what to look for. So think of these as the thief's calling card, the clues. You might start noticing patchy blind spots, especially in your side vision, or maybe seeing halos around lights. And then there are the risk factors, the preferred targets. We're talking about age, especially over 60, if it runs in your family, or if you have conditions like diabetes. These are all the things that should make you pay extra close attention. So let's put it all together. You've got a silent thief, a perfect cover-up by your own brain, and the damage is irreversible. That leads to the biggest question of all. How in the world do you catch it before it's too late? Well, here's the expert testimony that really cracks the case. It's from Dr. Luis Campanella, and it has a grim part and a hopeful part. The grim part? Vision lost to glaucoma cannot be recovered. It's gone forever. But, and this is a huge but, the hopeful part is that with early detection and treatment, blindness is almost 100% preventable. And that right there is the key. It's the whole takeaway. The only foolproof way to catch this thief is through a regular eye exam. An eye doctor can spot the signs. They can measure that pressure and look at your optic nerve long before you would ever notice a problem yourself. So yeah, the damage is permanent, but blindness is not inevitable if you catch the thief early enough.
So let's just end with this final thought. Think about it. You can't feel it, you can't see it happening, and the damage is forever. So that eye exam, it's not just a checkup, is it? It's more like an interrogation. It's your one chance to find out if this silent thief is hiding in plain sight and to stop it before it steals anything more.